Hello, and welcome to my podcast, Good Grief. My name is Dr. Christine Malone, and in this podcast, we talk about trauma, tragedy, and survival. In each episode, I will interview someone that has gone through grief in some way, and we will discuss the impact it has had on their life. By sharing these stories, we hope that others won't feel alone should they be going through similar situations. Enjoy. Hello, listeners. Thanks for coming to my podcast. Today, I'm not interviewing someone. I'm actually going to tell my own personal story about my journey with breast cancer. So, I have, since the age of 40, gone in every year and had my mammogram done, my screening mammograms done. I have no family history of breast cancer. And then in 2020, I was due to have my screening mammogram in the summer, but it was COVID. And I didn't want to go out and have a procedure that really, a test that really wasn't, in my mind, necessary because it was COVID and I didn't want to go out into a medical facility. So that December in 2020, the mammogram screening facility called me and they said they had openings and they wanted to remind me that I was past due for my scan and could I come in. It was December and I had some extra time on my hands from work. So I went ahead and scheduled my mammogram. I thought it would be just like every other mammogram I've had where there would be no callbacks, nothing whatsoever. Instead, I did receive a letter in the mail about 2 weeks later saying that they saw something that they wanted to further evaluate, and so I needed to make another appointment. Of course, I went into a bit of an anxiety issue at that time. I thought, what do you mean you found something? And when I called, of course, no one on the phone could give me any answers. They just set me up for another scan to be followed by an ultrasound. And that was about 2 weeks later. So I spent that 2 weeks with all kinds of issues in my head, horrible images of how I was going to die in no time whatsoever, because that's just the way my brain works. So I went in for the second scan and they had me sit in a room. And I have since come to know that room for women who have had breast cancer. Once you have your scan, you go sit in a room while the radiologist reads your scan to determine if any more images are needed or an ultrasound or anything like that. So you sit there with other women waiting to hear if you are the one with bad luck or not that day. So I had the ultrasound as well. And sure enough, the doctors did discover a very, very small tumor in my right breast. So I was referred to a doctor for a biopsy, and the biopsy came back and showed that it was indeed cancerous. So I was scheduled with 3 cancer docs, my oncologist, surgeon, and the radiation doctor. And I was scheduled to see all 3 of them on the same day for a meet and greet and talk about my prognosis, the procedure, so on and so forth, and all my different options. All 3 very nice people. We're still talking about COVID time, January 2021. So my husband couldn't come with me to those appointments, which was very frustrating because it was a lot of information to absorb in about 3 hours worth of doctor's visits. And I'm pretty good at taking notes. However, I know I probably would have picked up more things if I'd had my husband there as a second set of ears for those visits. So I had the surgery done. The surgery was in March of 2021. And but to back up a minute, so the tumor was so small that even though my 3 cancer docs knew where it was because of the scans and the ultrasound, they could not feel it upon palpation. So what I'm telling you is they couldn't even find it. So without that screening mammogram, I would never have noticed it until it had gotten much larger for that. So when I had the biopsy done, the doc implanted a locator device. The purpose of that was so that the doctor, when he did the surgery, would know he was in the exact spot where the tumor was located and could do the procedure and get it out of there. My sense of humor is one that's a bit on the morbid side. So I'm all about patient safety, and I love the fact that before procedures, doctors and their teams will have a little pause and ask you your name and your birth date and what are you here for, so that we're all on the same page, make sure that they're not going to perform some sort of procedure that isn't what I'm there for. However, my sense of humor especially when I'm scared and anxious, I tend to joke about things. So when the doctor did his timeout in the surgery room and said, what are we here for? I joked and said, well, I signed up for the liposuction, but apparently you were all out of those. So I'm here to have a tumor removed from my right breast. And that little laugh got me a little over the edge until the anesthesia kicked in and I was no longer awake. So I came to in recovery. A very good friend of mine was the one that brought me in and picked me up for my surgery. And I was sent home. I didn't have much in the way of pain. I had a very small scar, maybe about 1.5 inches wide, where the tumor was removed. I also had what's called a sentinel node or a lymph node removed. So I had about a 1-inch scar in my armpit from having that removed as well. So then my tumor was sent off to some lab in California where it would be analyzed to determine what type of treatment my cancer needed in order to get rid of it. So when that came back, I was brought back into my surgeon's office, and he went over in great detail exactly what this biopsy procedure, pathology, whatever had shown. And in my case, I was quite fortunate that I did not need to have chemotherapy. My cancer did not need that. However, I did need to go through a month of daily radiation treatments. So I scheduled with the radiation doc, also a very nice man, and the team of radiograph technicians who do the radiation procedures. Another part of my silly sense of humor, when I went in to have the doc determine what angle the radiation should go into, I was wearing a long sleeve shirt and I have a lot of tattoos. So the technician didn't see those. And he said to me, okay, I'm going to make 3 different tattoos for where the radiation beams will be entering your body. And I had to say that they are permanent. They're about the size of the tip of a pen marking. And I feigned as if I was just horrified that I was going to have these permanent tattoos, each the size of the tip of a pen, on my body. And he was reassuring me, it's okay, it won't even show, it'll be covered by your bra, blah, 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 trying to calm me down about having these 3 permanent markers. So of course, when he came back in the room and I was in a gown, he took a second, then he started laughing and said, oh, you got me. Because of course, as I said, I have quite a few tattoos, and those 3 small dots certainly don't stand out. So I went in for daily radiation therapy. At the time, I thought, I don't even need to slow down on my job. I can just keep on going. I'm a go-getter. I don't need to take a break. What is this? It's just radiation. It's just going in for some x-rays or whatever. However, that radiation kicked my butt. And I found that about day 3 of the first week, I needed to come home and take a nap before I could function. I couldn't stay awake late at night. And I was working on really overdrive. How I kept going, I am not sure, especially by the end of week 2. And by the end of week 2, my skin started to break down, which I'd been warned of that. I was told, don't use bandages or lotions because some things will actually peel the skin right off of the area. And so I stocked up on a bunch of different supplies to use. I have extremely sensitive, fair skin and burn very easily, even with sun. So I knew it probably would be ugly for me. And it was. I had blisters. I had very, very sore, couldn't wear a bra. I was wearing extremely loose t-shirts and so on, so that nothing would brush up too tightly against my skin. By the time the radiation treatment was over, I must say I was quite happy that it was. I thought that it would take me just, a couple weeks to get back to feeling quote unquote normal after that treatment. And of course, I was wrong. I underestimated how much the radiation takes out of your body, and that it does take your body a while to recuperate. And to this day, I still do not have the energy I had before that treatment. And I also do not have the memory I used to have. My mental memory, especially short-term memory, is not what it used to be. So once I had finished with the radiation, I still was seeing my oncologist doctor. She put me on a medication. It's a hormone blocker. It seems that my cancer is fed by estrogen. So she needed to put me on a hormone blocker. Of course, the hormone blocker has side effects of its own. which can include deterioration of the bones or osteoporosis. So I go in every 6 months and I have an infusion of a medication called Zometa direct into an IV, and that is to offset the deterioration of the bones. One of the side effects of the Zometa is or can be dental pain, which I do experience dental and jaw pain about a week after my infusion, and it lasts for about 2 weeks before it subsides. I will take that medication for the rest of my life, and I go in and have my scans. So after 6 months, 6 months after my surgery, I went in for a follow-up mammogram, and everything looked good. They didn't see any sign of any tumor recurrence or anything like that. My skin by that point in time, 6 months after finishing radiation, was healed. However, the skin where the radiation was done is a different color than the skin on the rest of my body, which I didn't expect. My scar was healing quite nicely by about 6 months. So around a year after my surgery, just before my 1 year, or 6 months later, I should say, 1 year checkup, I decided to go get a tattoo over that scar. So I wanted a tattoo of Wonder Woman because she spoke to me about the power of women and struggle and survival and so on. What I didn't really realize during that first year was just how much that entire process messed with my head, in the way I think, I should say. So when I was first diagnosed, I called my children. I wanted to let them know. I wanted to be sure that they were aware of all the different things that I was going through so they wouldn't worry. I'm very close to my children. And I also wanted to let them know that I had all of my affairs in order. I have been through loss in my life to where I know that we can go at any time. So therefore I have my will and my durable power of attorney. Everything is always up to date in my life. And that was no different. I told them where they would be able to find my life insurance policies, everything. So I was ready to go. At that 1 year point, so I'm 1 year post-surgery, I went in to have my scan done. And I was quite nervous at that one. I think at the 6-month one, it hadn't really struck me yet that the cancer could come back. At the 1 year one, I knew that it could, or at least it had occurred to me that it could. And I was pretty nervous. And I got myself up in a kind of a bit of an anxiety issue area. And people that I know that are on the same road I am, they call that scanxiety. So I went in to have the scan done, and I got to go sit in that special room with the other women who wait to see if anything else needs to be done. And I was sent on my way, no cancer. So I went out and I sat in my car and I cried for about 10 minutes to kind of let out that pent up anxiety that I'd felt when I went in for that scan. Feeling really lucky. I know the longer you go cancer-free, the more likely you will stay cancer-free. So I was pretty excited about that. I did go to get the tattoo. I love it. When I went in to see my surgeon for a checkup about 6 months later, I didn't tell him that he was going to see Wonder Woman on my boob because I wanted to surprise him, and he was quite surprised. Then part of my sense of humor again. So this year, I'm 2 years cancer-free. When I went in to get my mammogram this year, I had that anxiety again. I really don't know. I'm going to have to figure out how to address that so that I'm not quite so, it's like being on 17 cups of coffee. It's the adrenaline is flowing. It's very unnerving and scary. And again, my sense of humor comes out, and I try to deflect and say, oh, you know, everything's fine, whatever. So I went in with the tech, very, very nice young woman, and she did my scan, and we're joking about my tattoos and, you know, just like, oh, here I am. You know, this is just like every other day for me. I went and sat in the special room. While I was in there, the other two women were both called back for further scans. So I'm sitting there to see, well, am I going to be called back for a further scan, or am I going to be sent on my way? And the tech came in and she called me into the hallway and she handed me the piece of paper that said that I was cancer-free. And she said, you know, congratulations, you're now only going to need to be on this mammogram study once a year. You won't need to do twice a year and you won't need to do the ultrasounds. So I had hoped to get to my car before that flood started, but that wasn't my luck. And I don't like to cry in front of people, but I looked at that tech and she could tell that I was feeling emotional. And she said, "Do you mind if I give you a hug?" Which again is funny because I'm not a hugger. And I said, "I would love to have that hug." So I took the hug. She said, "You need to take some deep breaths," which I did do, went out in my car and I had a little cry. So that's where I am 2 years in. I want to end this by saying to my listeners, if you are due for a screening mammogram or someone that you love is, please, please, please don't put it off. I was lucky. I put it off because of COVID. And if they hadn't called me in December of 2020, I'm not sure when I would have gone back in, because 2021 was still scary COVID. And to me, the mammogram was a kind of like getting your teeth cleaned, right? I mean, I do that every 6 months, but I don't have to. I mean, I take care of my teeth. So it's not like I have to go in and do it. Same thing I thought with a mammogram. I've been doing them for 18 years before I had this happen to me. I have no family history of breast cancer. I also did genetic testing because I have daughters and I wanted to make sure I knew if there was something in me that could be in them. And I did not come back positive for any genetic markers for any types of cancer. So yes, if I could encourage you to please, if you do, get that screening mammogram. It takes just a few minutes of your life, but it can save your life. So thank you so much for listening.
Thank you for listening to this episode of Good Grief. To hear more about my personal story, please pick up a copy of the book, The Spider Killer, a memoir of trauma, tragedy, and survival. You can find the book on Amazon and Kindle.